is a first response kit. In the top front pocket is where you'll find an adult blood pressure cuff, a pediatric blood pressure cuff, a stethoscope, a thermometer, a blood glucose level testing kit, and a pupil torch. In the side pocket here is your trauma care pocket. This is where you find tourniquets, gauzes, bandages, tapes, steri strips, and comba dressings. In this top side pocket here is where you'll find your vomit cups, your numbing spray, your cervical spine cord, and in your bottom side pocket here is a drawing syringe, oral glucose, liquid glucose, and a pre-drawn glucagon kit. Move to the inside. In the top pocket inside here is your medications pocket. This is where you'll find pain relief and antihistamine tablets. In the second pocket down is your OPAs, MPAs, lubricant, forceps, and your laryngoscope. In your bottom pocket you have your oxygen tubing, oxygen masks, and then your adrenaline, prednisone, and salbutamol. In your main pocket here you have your pediatric and your adult bag valve masks, your LMA kit with 5 different sizes of LMAs and 2 sizes of Thomas holders, your IV kit with different sizes of syringes, needles, and it also has saline solution. And then floating around in the rest of the bag you have a towel, you have a litre of saline solution, you have a sharp spin, a slippery Sam, a neck brace, and cardboard splints. Just to make sure for all sterile equipment and medications that the expiry date has been checked and that it is not expired. This here is an oxygen bottle, and this here is a regulator. I will be checking the Bodac seal on the regulator, make sure it's intact and in good condition. When attaching the regulator to the oxygen bottle, I will be aligning these 2 pins in here along with the corresponding holes on the neck of the bottle. And then I'll be screwing to tighten it in place. To turn on the bottle, I would be turning the top anti-clockwise, and then this gauge here would fill up. Unfortunately, this bottle is actually out of oxygen, but I'll show you anyway. I will also be testing the bag valve mask, so I'll just pull it out and check the bag valve for any wear and tear. I will then be testing the reservoir bag by filling it up with air and making sure there's no leaks. It looks pretty good to me. I'll then attach it to the end of the bag valve mask here. I will then attach the filter and the mask, and then I will attach the bag valve mask to the oxygen bottle. Right here. To turn on the oxygen, I would be turning this part here, and since it is a bag valve mask which the flow rate is 10 to 15, I will turn it up to 15 to start with to fill up this reservoir bag here. And then once it is full, I'll probably switch back down to 10. The flow rates can differ between different masks, but since it is the bag valve mask, it's 10 to 15. And then to turn it off, I will turn this back to 0, unplug the bag valve mask, turn off the oxygen bottle by turning it clockwise, and then I would release the pressure built up in the regulator by turning it on all the way until all the pressure is out and all the oxygen's out. Then I would turn it off and unscrew the regulator, and then I can take the regulator off, easy peasy. This here is a suction unit The first thing I'm going to do is test the unit by holding down test and turning it on. It goes through the different stages of test. There's 4 different stages. And the test is finished. This here is my patient. He is lying laterally. The first thing I will do is turn on my suction unit to full. Unfortunately, the batteries are a little bit low, so it's not getting the full suction. I will then insert this nozzle bit only as far as I can see, and then I will only suck on the way out, and I will suck for no longer than 10 seconds. The complications of the suction unit is this part here is rigid, so it can cause damage to the roof of the mouth, the back of the throat, the tongue, and even dental damage. This here is the LifePak 12 monitoring device. The first thing I'm going to do is check the batteries in the back by pushing the buttons. It looks like both of the batteries are low, so before shift I would change them for some charged ones. I'm then going to turn it on.
Connect electrodes.
I'm then going to press advisory and then yes to enter manual mode, and then I'm going to click on options, scroll down to user test, press select, and while the user test is running I'm going to go through the pockets. In the back pocket here is where you'll find your blood pressure cuff, your defibrillator pads, your ECG dots, and your spare roll of paper. In the side pocket here is where you'll find your defibrillator cord, your test shock load, your GT spray, a razor, and your aspirin, checking the GT spray and the aspirin for your expiry dates to make sure they're not expired. And then in the side pocket here is where you'll find your SpO2 reader, CO2 tubing, your 4-lead ECG, and then the additional 12-lead ECG. You plug in your 12-lead ECG by lifting up this flat on the 4-lead ECG here, and then just plugging it in. I would also check the paper before to make sure there's a full roll of paper in there. So the user test is done. It says it's passed, which is good. I will then click lead, and then I can choose between different lead sizes and different leads to check. I will then press size, and then I can change the different sizes on the screen. I will then click the selector knob and scroll to the left, and then click on that to increase the or decrease the QRS volume depending on how loud you want it. I will then plug the test load into the defibrillator cord and then press energy select. I will put it down to 50 joules and then charge. I will then deliver a shock. Shock has been delivered. I will now charge another one at 50 joules, but this time I'm going to disarm it before it's fully charged. I can also click the options button and choose between the date and time, alarm volume, and many other things. And I will also do a test print. Everything looks A-okay. We have been called onto the scene of a suspected cardiac arrest. There are no obvious dangers. There's one bystander who called us here, and we're inside and it is easy accessible. We do have our gloves and our glasses on. Are you comfortable going into the scene? Yeah. Cool. Hello, can you hear me? Can you open your eyes for me? I'm Abbey and this is Alina from AUT Ambulance Service. Hello, he is not responding to verbal commands, so I will try pain. Hello sir, can you open your eyes for me please? He is not responding to pain. I will open his airway and check for any obstructions. There are no obstructions. I will check his breathing by listening and watching his chest for any rising for 10 seconds. He is not breathing. I will attach the defibrillator. Can you please jump on compressions? I will also call comms for backup.
Do not touch the
Can you please
patient.
get off the patient? Comms, can you, we have a suspected R49. Can you please send an R50?
Shock advised.
Nobody touching
Charging.
the patient, please.
Stay clear of patient. Deliver shock now.
Everybody
Press
clear?
the orange button now. Shock,
Shock delivered. Can you jump back on compressions,
Four.
please?
Start CPR.
I'm now going to set up the bag valve mask. If you could count up to 30, that would be great.
25, 26, 27, 28, 29, 30.
I am administering 1/3 of the bag and watching for chest rise and fall. I'm also putting a towel under his neck to open up his airways. And getting an OPA and MPA ready.
27, 28, 29, 30.
I'm using a CE grip to prop back his jaw and to ensure a tight seal around the mask. I am now going to measure the MPA from the corner of the nose to the corner of the mandible and lube it up and insert it.
25, 26, 27, 28, 29, 30.
The constrictions of an MPA, bleeding and polyps. You would use it if there is jaw lock. I am now going to measure up an OPA from the corner of the mouth to the corner of the mandible. I'm going to insert it facing me, and then I'm going to turn it 180 degrees.
30.
Complications of a OPA is that it is rigid, so it could cause soft tissue damage inside the mouth. On the next analyzing of the defibrillator, we're going to swap places.
$25, 26, 27, 28, 29, 30.
Stop CPR.
Stop CPR, not touching the patient, and we're
Analyzing
going to
heart
swap
rhythm.
places.
Stay clear of patient. Analyzing heart rhythm. No shock advised. Pause. If needed, start CPR.
I'm going to start my CPR by centering my hands in the middle of his chest and going down about 4 to 6 centimeters. 22, 23, 24, 25, 26, 27, 28, 29, 30. We're doing 30 compressions to 2 breaths. This is also a good time to ask bystanders if they know the patient's history or has seen what happened today. 25, 26, 27, 28, 29, 30. My offsider is ensuring that there is a good grip on the mask to ensure that there is no air escaping and optimum airflow. 25, 26, 27, 28, 29, 30.
30. Twenty-four, 25, 26, 27, 28, 29, 30. Twenty-seven, 28, 29, 30.
Stop CPR.